A lot of us get the blues every now and then, but if you're faced with severe depression, it may be time to seek professional help. For members of the Bronx's Latino community, taking that step can be especially challenging. As part of WFUV's Issues Tank project, George Bodarky reports.
Zoraida is of Puerto Rican descent and lives in the South Bronx. She asked that we withhold her last name. She's a single mom. Her daughters are 21 and 15. Zoraida suffers from depression and anxiety. She says her condition resulted from the murder of her youngest brother in 1995. Zoraida says it took her about 8 months to seek out help because she was afraid of what people in the community might think.
People out there, sometimes they think if you in a psychiatric place, you're kind of crazy.
Zoraida's getting assistance at the Fordham Tremont Community Mental Health Center. Patty Smalls, the center's former director of Community Behavioral Health Resources. She says battling the stigma of mental illness can be especially challenging for Latino men. She says machismo often gets in the way of them seeking help.
Men are really looked at as the patriarchs in the family, and it's considered a weakness to admit to any kind of psychological distress.
Small says low socioeconomic status is also a barrier to mental health services for Bronx Latinos. She says when you're among the working poor, it's hard to find enough time in the day to come in for care. I'm George Bodarky, WFUV News.
For more on depression in the Bronx's Latino community, visit WFUVnews.org.